All right, good afternoon and welcome to the second webinar in the 2021 MSHA webinar series. Today we'll be talking about COVID-19 and MSHA, best practices and compliance strategies for mine operators. Now we intended this to be a webinar long before the MSHA guidance came out last week. So we will spend the majority of our time today reviewing that guidance so everyone knows where we're at and where you stand with the Mine Safety and Health Administration. For those who are new to us, welcome. My name is Nick Scala. I'll be your host today, the voice coming at you through the computer or your phone. I am the chair of the National MSHA Practice Group at Con Maciel Carey. I'm also a certified mine safety professional. My practice, it really works with companies, employers nationwide on MSHA and OSHA matters, really kind of soup to nuts, anything dealing with the agencies. On the MSHA side, working with mine operators, with contractors, doing counseling such as non-enforcement matters with COVID, and helping you put in place effective policies and programs. All also can help you and represent companies in pretty much all aspects of dealing with MSHA through inspections or investigations, all the way up to litigation before the Federal Mine Safety and Health Review Commission or beyond. So hopefully we don't have to get into any of the investigations, whether it's a 110 or a 105C regarding COVID, but that would also be something that we can help you out with. So, with that, we want to look at our agenda today. So what are we going to be talking about? As I mentioned, MSHA released some more detailed guidance and really some of the most substantive guidance since the COVID-19 pandemic began roughly a year ago in the US. So we're going to take a look at what that guidance is. We'll take a quick snapshot through the MSHA reaction to COVID from when it began to present. Then we'll take a look at the guidance and specifically break down some of the elements of what MSHA believes are critical to a COVID-19 prevention program and what that prevention program is. We'll also talk about reporting to MSHA. So really what it comes down to when we're looking at is a 7001 necessary if an individual gets COVID at our mine site or one of our workers comes down with COVID. So we'll talk about that because it's a bit of a departure from what we've heard previously under the Trump administration from the agency. And then lastly, we'll take a quick look at what could be some expansion into the enforcement of 105C or whistleblower claims, especially with respect to COVID in the workplace. So, a good bit to break down. We'll try and do our best to keep us on pace and on track for our conclusion in an hour or a little less than now. But, again, if we have questions or there's additional questions, I'm always happy to stay after and answer those. And if there's any reason you got to drop off early, the recording will capture the entirety of the webinar, no matter when it ends. So those will be available. So where are we at with MSHA and the COVID pandemic? We'll talk about where we're at currently, but how did we get here? So we all know that we're roughly over that year mark that COVID has been a concern and been impacting the workplaces in the US significantly. President Biden just recently gave a speech and address regarding the 1-year anniversary. So what has MSHA done throughout that? Well, really up until recently, there hasn't been a lot of guidance. We had some initial guidance posted from MSHA in March and April of 2020. That guidance was just one real link on the website and a quick web page. And, it pretty much told us that MSHA is going to continue to do their inspections and their investigations. But they wanted mine operators to take precautions, follow CDC guidelines, look to OSHA for guidance where needed, and, voluntarily relay that information back to MSHA. It gave a bit of leeway on training records and training requirements for annual recertification, annual refresher training, but also was sure to be clear that they weren't giving operators any passes on completing new miner training, newly hired experienced miner training, or task training. So that is really what we had to go by with MSHA for the vast majority of the last year. We did see a bit of a slowing in MSHA inspections at the beginning, and there has been some hiccups just based off of their own issues with COVID shutting down certain field offices or certain inspector groups. But by and large, they have continued their mandatory 2s and 4s and their inspection focus. We have not seen a great deal of citations related to COVID. With MSHA, we haven't seen a great deal of investigation specifically into COVID. They have occurred, but not in volume, not like we've seen at OSHA sites. So, will this be a changing of the tide now, or will we continue to see maybe a similar approach, but with a bit more specifics put into black and white like we got with the new guidance? Additionally, what MSHA did is, you may recall, they put out some graphics, some infographic pamphlets with the CDC, again, just really relating to what the CDC guidance is, and, giving some general best practices to the industry in something that could be hung up pretty easily. But other than that, we haven't seen a whole lot. There was some significant push over the summer from labor groups to get MSHA and OSHA to file and propose and put into effect emergency temporary standards. Emergency temporary standards would give MSHA something to cite employers for failing to comply with regarding COVID. Okay, so OSHA got sued in the federal district court in the District of Columbia. The court found in OSHA's favor, not forcing them to put an ETS in effect. Shortly thereafter, another group of labor organizations, the UMWA and the United Steelworkers, sued MSHA, requesting a similar relief, that MSHA be forced to put an emergency temporary standard into place. Again, the DC Circuit deferred to MSHA, saying that they will determine when that's necessary. So, we have continued to see less guidance from MSHA. At the time that OSHA was getting sued in this, they were rolling out pretty significant guidance for industry. They were moving forward with some inspections specifically regarding COVID. We didn't see the same level of activity from MSHA. And so there was some thought that maybe the MSHA lawsuit would have a little more traction, but it did not. So, there's also been the kind of the side on the legislative. There's been a couple actions proposed for the COVID-19 Mine Worker Protection Act. It has actually been proposed again just recently in both the Senate and the House. So, but there's been no votes on it. There's no real absolute that those are going to go into effect. So where that leaves us is, to date, we saw the guidance, and that really kind of took off after President Biden took office. And on January 21st, so his first day in office, he issued an executive order. That executive order was on protecting worker health and safety. In it, it was primarily focused on OSHA, but it included that the Secretary of Labor, acting through the Assistant Secretary of Labor for Mine Safety and Health, so the head of MSHA, shall consider whether any emergency temporary standards on COVID are applicable to coal and metal non-metal mines and are necessary, and if they're determined to be necessary and consistent, issue them as soon as practical. So, that is much different than what we saw in this order for OSHA. OSHA was required to issue new guidance, which they did. OSHA was required to review whether or not an emergency temporary standard was necessary, and if so, put one into issue one by March 15th. They have not issued that by March 15th, but they've kind of moved the needle a little bit. And, we do expect an emergency temporary standard to come out from them in the next couple of weeks, by probably early April. But in that, it is, we are seeing a deadline on OSHA to kind of make those moves. MSHA didn't have any such deadline. And so, we're going to continue to see MSHA kind of feel their way through this. And a lot of that is going to be based off of what OSHA does and what OSHA's emergency temporary standard looks like and how it is being enforced. is MSHA done with this consideration? No, they aren't, but you know, they aren't going to do it right now. So, you know, when we had this guidance come out, you know, I mentioned that it came out on March 10th. There was also a call that day with stakeholders from MSHA, and we had the current MSHA leadership on the call. And, you know, when asked about the ETS, they said they're putting out this guidance, but they're still making decisions about whether or not they are going to issue an ETS. So they didn't commit one way or the other. A lot of that is going to be looking to see what OSHA does. As I mentioned, there's still this Mine Worker Protection Act. You know, what does that include? It was going to require MSHA to put in emergency temporary standard. The main elements of that are included on the screen. So develop and implement infectious disease exposure control plans, provide PPE, CDC and NIOSH guidance. You know, we should see similar themes in that with what the MSHA guidance we're going to review today looks like. So, you know, if this guidance is deemed to be effective, you know, we probably aren't going to see a whole lot of action on the Mine Worker Protection Act. If there still is a lot of concerns and some uproar that these provisions aren't doing anything and mine operators aren't complying with them, there is, you know, likelihood we could see some movement from the House and Senate on that, even if MSHA does not voluntarily agree to put into effect an ETS. So that's to say we have new guidance. An emergency temporary standard from MSHA is not imminent at this point, but it's still very much a possibility. There's also still a very good possibility that MSHA is just waiting to see what OSHA does, as I mentioned, and then will implement and tailor that to their own purposes and put out an ETS after MSHA or after OSHA has already kind of laid that groundwork for them. So that brings us to really last week. And when we're looking at this MSHA guidance, so it is, you know, the guidance for mitigating and preventing the spread of COVID-19. You know, hopefully you've all had a chance to look at this. If not, it's available on MSHA's website or on the information we put out on the MSHA Defense Report blog, and you can access it directly. It is more detailed guidance. It isn't really anything groundbreaking other than what we've seen come out of OSHA and really just as best practices since this all began. It's largely based and designed to feed off of and work cooperatively with OSHA's general industry guidance, which again leads us to believe that if a general industry standard comes out, it could be applied to MSHA's ETS framework. On the stakeholder call, we reviewed the guidance quickly with MSHA personnel. There was some questions, but there, you know, not a lot of substantive. There's still a good bit of gray area with this, you know, so we're going to have to feel our way through it. We're going to have to see what the agencies take on it. And also the big thing is going to be how the inspectors react to it. And, you know, that's because first and foremost, this is the opening paragraph of the guidance up at the top. It says it contains recommendations as well as descriptions of mandatory safety and health standards. That's because it specifically lists some standards that we'll go over later. The guidance itself is not a standard or regulation and creates no new legal obligations. Okay, so these are supposed to be advisory in nature. You know, it's something that they say it's intended to assist operators in recognizing and abating hazards, and that is part of their obligation to provide a safe and healthful mine. It also then goes to say that operators should implement a COVID-19 prevention program at each mine. So, you know, the question is this guidance, or is this going to be acted upon as if it is some sort of regulation or requirement? You know, that's the million-dollar question, right? I think, you know, legally it is guidance from the point of being able to enforce it, but I think we'd be naive to think that MSHA isn't going to put a more significant onus on, you know, looking at what programs might exist at a mine. Are the programs containing all these essential elements that MSHA lists? Are we training on the programs, and do we have a record of the training on those programs if we are providing it? And these tie back to those mandatory standards that MSHA is going to list at the end of the guidance itself. So, we want to be prepared that MSHA could look for these and could ask for them. Now, they said that plans don't have to meet the approval of MSHA and don't have to be inspected by MSHA prior to being rolled out, but I don't think that necessarily means they won't be looked at and scrutinized. So you could get some inspectors asking for them. If you don't have one, that might create additional scrutiny into why or why not. So these prevention programs are something that employers are going to want to put together. Likely, a lot of the material that MSHA wants to see in them, you already have in place. And, a lot of companies have already put prevention programs in place or exposure control plans, whatever name they might go by, but just kind of a consolidated area where all of their COVID programs and policies are housed together. And that's, if we haven't done that, and we kind of have these piecemeal, MSHA said, that's fine, you can have them as part of the other programs, but I would recommend that you consolidate them into a single document. And that's for the purposes of just making it easier to find, easier to update, easier to provide if they're ever asked for, whether by a miner or a contractor or an inspector. So, these are something that we should be doing. MSHA is going to expect that they are being done, although they can't mandatorily require that one is done. If there is any reason that there's complaints into a mine-specific reaction to COVID or hazards there that are not being abated, or just hazards in general, I do expect MSHA to take a more active role in coming out and trying to get to the bottom of what's getting done there. The one big item that we don't see a lot before, and that's because it's really a requirement on the OSHA side, not on the MSHA side, but as a hazard assessment of the mine. This is really going to be, reviewing where there's possible exposure risks and how we're going to address them. So it's a specific term that, we might call JHA, JASA. In OSHA, they have to be certified. We don't have those specific requirements here, but MSHA is expecting that is one of the key elements of what you're going to do, and it's going to help provide the framework for this. A couple other the high items or the high hit items are identifying measures that limit the spread. Again, those are things that we're probably already doing, including administrative controls or engineering controls. Measures or a program to keep those infected or potentially affected away from the mine. I sincerely hope that we all have done that at this point. And then protections for retaliations for miners who raise COVID concerns. And we'll talk about each one of these a bit more as we go through it, but I think that last one is an interesting inclusion by MSHA, and it's mentioned a couple of times throughout the guidance, and it's something that we're seeing on the OSHA side, and I think we're going to continue to see it even when COVID passes. The whistleblower protection program grew significantly under then President Obama and Vice President Biden. It did take a step back to an extent under the Trump administration. I think we all, who are dealing with the agencies on a regular basis, and MSHA in particular, expect that investigations and prosecution of whistleblower claims will probably increase under this administration again. And COVID-19 is one area where they're targeting that to get going. So, you got to be able to look at what that is and understand what miners are allowed to do. And we'll talk about this a bit later in the presentation. And then also train and prepare your management teams to respond to these claims and address them, or even work with the investigators, because the 105C or the whistleblower investigations and process can be pretty burdensome to employers going through it with MSHA. So that is an area that will be looked at if miners are calling in complaints, I expect MSHA to be out and looking at them a bit more aggressively than they even were previously. That's always something that MSHA is going to respond to even earlier in the pandemic, but I just feel like they might be getting a bit more of a magnifying glass on those kind of claims. So, next then, as we read through it, it talks about some other just kind of legalese, outlining again that operators must comply with safety and health standards and regulations. And then again, we go through, who has the primary responsibility. It's mine operators. And it does say with the assistance of miners, but mine operators have the primary responsibility to prevent the existence of unsafe and unhealthful conditions and practices at mines. And then once again, MSHA jumps into operators should implement a COVID prevention program in the mine. So that is really the takeaway from this guidance, that MSHA anticipates and expects and recommends that all operators develop and put into place a mine-specific program. It includes general recommendations too, such as, continue to use face masks, continue to, sanitize frequently and teach miners on the importance of doing that. But this is really about the COVID prevention program. That is what this guidance links to. So what are the essential elements that MSHA outlines, and how do we work those in? So the first thing that MSHA outlines is relatively straightforward, but identify a mine coordinator. And this is supposed to be a person who is able to communicate with the workforce at that particular location often about the mine's programs or any other questions regarding COVID-19. The person should be accessible. The person should be knowledgeable and know how to get answers and questions, and be able to react to concerns that are being raised. It does not have to be, though, someone that is permanently housed there. There's no requirement there. So if you have, a safety person who is over a couple mines in relatively close proximity and spends times at all these operations, that could be your coordinator. But it just needs to be someone who's available to the workforce to talk with them and can be the point person on this. So, the question is, how do you determine that person, and what does that person have to know? That person should be very familiar with all aspects of the program. If you are rolling out a larger program down to be made more specific for each site or each mine, that person should be involved in the process. They should be able to go through with whoever drafts it, the specific elements of it, ask their own questions, and know where to go if they don't have the ability to answer a question. But that's really pretty, straightforward. Each program, each exposure control plan, you typically have someone in HR or safety, or depending on your operation, even someone at the operations side, who is going to be the point person for the workforce. And that's just what that is. The second one is really what we were talking about before, when you have to do a hazard assessment. And if you're going to do a hazard assessment, it doesn't say this in here, but document it. Document the areas that you evaluated, what could be the potential causes of COVID exposure in those areas, and how are you going to mitigate them? This can be things like rotating workers on start times, or rotating workers on break times and break rooms, or limiting the capacity in certain areas. You want to make sure that you evaluate, hey, the lunchroom is an area where this could be an exposure. And then what are we going to do to try and fix it? Can be item 3, identifying measures that will limit the spread. MSHA focuses pretty heavily on the hierarchy of controls. First of all, will be removal from hazard. They make reference multiple times to working from home where practical. Obviously, for production personnel, that's not a very practical request. So, then you're looking at engineering controls or administrative controls. And if you can't get really to remove the hazards through those, or control them or mitigate them, PPE. So, again, when we're talking about engineering controls or administrative controls are going to be work practices. Engineering controls could be improvements to ventilation or rearranging the workplace and the work areas so that there is greater distance or separation between employees, and so that they don't have to, work in close proximity. Maybe you're putting up barriers so that there is some workspace between them, or you're spreading people out in a greater area. So those are areas that we want to consider. And if we are going to be implementing measures, we want to consider documenting what we're going to do in what locations, or for what person's doing what task. So maybe it is just, this production group who works in a certain area of mine is going to do this in terms of the identifying measures to limit the spread. And that might be staggered start times, as well as reworking where they are allowed to operate to perform their duties to keep a greater distance. So again, relatively straightforward items in that size. MSHA does expect that you're going to continue to provide the personnel with supplies for good hygiene practices, be it hand sanitizer or soap and water access or new masks. Those are things that they are going to expect you to provide or continue to provide based off what are you doing. Hopefully those are things that you've already been implementing at your work site. It also wants you to go through and educate and train miners on the program and the policies. And so this is a big one. This is one of the standards that MSHA specifically lays out, is the training regs. So if you are going to put out a program, or if you have one in place, train on it. If you trained on it a year ago and you've made changes or you've updated it, train again, retrain, and just document that. Again, the old rule with any kind of regulatory agency is if you don't have it documented, it didn't happen. That's the same for training. So review your program, review your plan. This can be done in small groups to avoid a large gathering. It can be done staggered to avoid large gatherings. Review the plan though, document that you reviewed it with each person. You can have them sign an acknowledgement, give them the opportunity to ask any questions on it and review it. This could also include reviewing the relevant CDC guidance or your local or state guidance, because that's something that you need to consider as you go through this process, is that local and state guidance is out there, and it applies to the work site just as much as the MSHA guidance. So we got one question that came in. I think it makes sense to answer it now. We'll talk about it a bit as we go forward, but the question is, if all miners at a location have been vaccinated, are any of the essential elements of the prevention program no longer required? So we'll see this on the next slide, but MSHA, per their guidance, does not want you to treat vaccinated miners different than unvaccinated miners due to concerns just about there is a possibility for transmission even after vaccination takes place. There's still a lot of unknowns about how effective vaccination is and for how long. So, as their best practices, as their guidance is that even if miners are vaccinated, they should be treated as though they are unvaccinated for the purpose of adhering to kind of best practices and safety practices at the site. One of these items that continues to come up, and is somewhat surprising, is that MSHA puts in here multiple times that we should be instructing miners who are infected or potentially infected to stay home. Hopefully that is something we have communicated multiple times and very clearly to any miner who is on our site or may be on our site. If someone has potentially been exposed or has been exposed, they should not be coming to work. We should have made that clear many months ago. We want to try and make this as easy as possible. And MSHA recommends minimizing the negative effects of quarantine or isolation. What they're really meaning here is, think about your policies in place for sick leave. Are you going to give additional sick leave? There are some tax provisions that would give operators the ability to collect on the backside for missed time for miners that have been off because of potential COVID exposure or having COVID themselves. But consider what you can do to make this an incentive or to disincentivize minors coming to work after they've been exposed or after they have potentially been exposed, because these are areas where you're really going to, potentially have an issue because someone is trying to miss time because they might be penalized for it. So you need to consider that, and you need to make sure that is one of the elements that is very well communicated. Also, when training on your program, you should be training just on the basics, right? Training on the really low level information to make sure everyone is clear about how COVID is transmitted, what you should be doing to protect yourself, what kind of instances could create an issue with potentially being exposed, so that they know when they should not be coming in. Also, what are the symptoms? Those are all things that we need to be including in this training and including in our program. And again, we don't have to rewrite anything here. We can pull information from the CDC. We can pull information from this guidance itself about what the symptoms are and how it's transmitted, and we can provide training on that. So next we go through, again, pretty straightforward, but if minors come to work and they show symptoms, they need to be immediately isolated until they can be removed from the site. If that is the case, we want to then look at what are our cleaning procedures. We should already be engaging in enhanced cleaning just throughout the facility, especially high touch or high traffic areas, which might be mobile equipment. If we're having individuals use mobile equipment and it's run around the clock, and so each shift different person is getting in, that equipment should be disinfected in between uses. If we have persons who are showing symptoms or who have symptoms and they are in the workplace, there are specific CDC guidelines for how to clean. MSHA recommends that you close off that area, that you follow these guidelines, that you try and wait at least 24 hours before beginning cleaning in the area, just to protect those who are going to do the cleaning. But there's also important elements here with the PPE and your HAZCOM regulations, because first you got to provide the individuals with the required PPE are going to be performing the cleaning to do so safely, and that's going to involve also reviewing what cleaning products you're using. Now, there is a specific EPA registry that provides all the different substances that are known by the EPA to kill COVID. We should probably be using one of these. Each one is going to probably have its own requirements or suggestions for protective equipment. So we want to review this. We want to train our individuals on it. We also want to, look through and make sure that we're putting that into our HAZCOM. If there are new requirements, because there's a new substance on site that might trigger HAZCOM requirements and HAZCOM training, is that being done? So again, these are areas where training really comes into it, and a bit of record keeping there. We also want to educate everybody on what to do for screening and testing. And so that's not only us performing it ourselves, but making the workforce aware of where testing can take place if it's not offered on site. What are the guidelines on reporting if there is testing and something comes out positive for contract tracing purposes? Also, are we going to be requiring individuals to do pre-work screening? That doesn't have to necessarily be done by the company. It can be educating the minors on, again, the symptoms and reviewing interactions. What will they have to do to look at their symptoms to see if they have it at the time or before they come on site? Are they showing any symptoms? If they are, they shouldn't come on site. That should be part of the training. So these are, again, relatively straightforward items, but MSHA wants to see them written out into this plan. So the two items on the screen right now listed as are in orange is to record and report COVID infections and deaths. This is a big item. It's a bit of a departure from what we've heard from MSHA previously. So we are going to touch on that when we get through this list. So I just want to put those in orange because we will touch on it. The same is going to be for provision 12, because this is having to go back to essentially the 105C and the whistleblower protection. So we're going to take a bit closer look at those just in the next few slides. 13 says to consider making COVID vaccines or vaccination series available at no cost to all eligible employees. If we're going to go this route, there are concerns and also how to deal with those who don't want to receive it. You should consider getting a detailed policy about your vaccination program, what is going to be required, how you're going to react to each one of those circumstances, who's going to provide it, and when are they going to provide it. The other option is, consider just letting minors take work time to go get their vaccination. Depending on the vaccine they're getting, it's 1 or 2 shots. Let them take that time off of work and be compensated to go get it. That's something that I'm just suggesting, again, just to incentivize individuals to get the vaccine. There's a lot out there. Can we give a bonus? Can we require it? There's questions regarding making it mandatory because these are emergency use authorizations. If you do want to look at requiring vaccines, or you do want to look at what are your options on the vaccine side, I do recommend that you take a look. Our employer defense report has put out a good series on vaccines specifically with 2 or 3 webinars to give you some guidance there. Just reach out. But that is itself a pretty big question, a pretty big element that would deserve a great deal of discussion on it. But just consider what your options are. So one of them might just be allowing individuals to go on work time and making that clear to them. So again, they're incentivized to do it without feeling like they have to miss work to do so. The last one is that element that just says treat vaccinated the minors the same as those who are not. And again, that is MSHA's suggestion, just to make sure that there is a continuation of safe work practices. I see there's a question on this, so I'll take a look at that now, and we'll talk about that. Okay, so the question is, this particular individual says their company is intending to have a voluntary vaccination policy and understand that some will not get vaccinated. One incentive they are considering is allowing vaccinated minors to work mask-free when not within 6 feet. Currently, their site is 100% masks at all times. So the intent of this provision is to have minors who, again, are vaccinated still protect themselves and protect other minors, since there's questions about the efficacy of the vaccines. They aren't 100%, and likewise. With regard to wearing masks, that's something that you all can consider as an operation. Typically what we have been recommending is that employees wear masks unless they're not within 6 feet, or they're in a separate area, being in their own office by themselves, or in a piece of mobile equipment by themselves. But if they're in a spot where maybe they're working 6 feet away from 6 feet at this point, but someone could work within that area at any point in time, they would currently wear them. So if you wanted to incentivize it as allowing people that are working in an isolated area, that there is not a real good likelihood that someone's going to walk within 6 feet of them at that time, I think you could do that just because of existing guidance. Again, close contact for the purposes of exposure is within 6 feet for 15 cumulative minutes or more in a 24-hour period. So that is what is considered close contact, and some of the areas where you're going to especially be wanting to wear masks and protection. You could try that route. I think that what MSHA really wants, though, is, and what they're saying in this is, there's still questions about the vaccine and what it's going to do to prevent exposure, and also what it's going to do to prevent transmission. So someone with the vaccine, even if they're not showing symptoms, could still possibly be a carrier and give that off. again, the science is new, the science is not 100% clear. So, if you have people who are working in isolated areas, I think you can consider it, especially if they're being vaccinated and if the persons are vaccinated. But you need to make sure, or you would want to make sure, not need by any regulation, but you would want to make sure that there's not a good chance that anyone's going to walk up on them or walk by them and be within a close contact radius. So, that's something that you could certainly consider as an incentive to get the vaccine. But if you have an area where they could be next to each other at a moment's notice, I still am not sure that it's something that you would want to do. There is risk there still. So when we're looking at the regulations, though, that MSHA wants to talk about, they really, and this has been part of the issue the whole time, don't have anything on point for issuing enforcement with respect to MSHA. OSHA obviously has a general duty clause where they can do a catch-all and issue a citation if you're not following recognized guidance, industry guidance on the hazards, and it's recognized by industry and the employer. Obviously, the hazard of COVID is recognized by everyone at this point. MSHA doesn't have that standard, so it's difficult for them to enforce. What they put up here on sanitary requirements is, for metal, non-metal at least, housekeeping, 56-20,003A, that's not meant to apply to germs. If you read through that, it specifically mentions nails sticking up in walkways and on boards. It talks about accumulations of material. It can be issued there, but it's not a very good standard for that, unless you just have rampant amounts of trash piling up all over and it's believed to be contaminated with COVID. The other one they list in the sanitation is 56-20,008B and 57-20,008B. And again, I'm just looking at the metal, non-metal for this part. This is for bathroom facilities, and it specifically relates to bathroom facilities. And Section D of that, 56 and 57-20,008B, doesn't specifically mention toilet facilities in it, but it's referring to them. So again, not really the same as what they're looking for. Training requirements is going to be one where I think we could probably have enforcement. Again, if you have these plans in place, are you training on them? It's not required to have this plan, but if you do have this plan, you should be training on it. So are you doing that? Are you recording that training? How is that being completed? Those are areas where I think that MSHA could go, because just if we have a program, if we have a policy, we should be training our workforce on it. That's the same if it's lockout, tagout, or what it might be. Now, we're not required to have this prevention program, but if we do have one, we should be training. And if we have an instance where MSHA comes on site and there's a complaint, or there's found to be some kind of issue with COVID in the workplace, I think there could be issuances and enforcement regarding whether or not we trained on what we had prepared. Workplace exams, also one that doesn't genuinely fit, but I think is a bit more broad and a bit more of a catch-all than even housekeeping. And so that is one where you could really look at there being some potential for enforcement, especially because it can tie back to the hazard assessment. Are you assessing the site for hazards? That's part of what you do on a workplace exam, is you're trying to identify adverse conditions which may exist in the workplace. So, that is, again, one that it has the ability to be a bit more of a catch-all, and that's why I think it's listed there and probably one of the more possible ones. The last one is personal protective equipment. If you are giving people PPE, just remember you got to train them on it. You got to train them how to use it and store it and maintain it. And that is, that's obviously one that could apply. But really, when I look at these, I think the most likely enforcement actions could be with training or workplace exams. And that's because workplace exams can be construed very, very broadly. And there's also, the discussion of this. There's an adequacy requirement in the workplace exams after some litigation that has gone down with the Federal Mine Safety and Health Review Commission recently. And, the answer there is there has to be some adequacy to them. So that could be tied back. But again, these are all pretty loose just because MSHA does not have any infectious disease standards. So, something to keep an eye on, but if you do have a program, I recommend you train on it, you document that training just like any other program that you would do. So the big change, or one of the big changes, is on reporting and recording. For the most part, MSHA has treated COVID for the purposes of reporting similar to cold and flu, which means they haven't really thought of it through the Trump administration as a workplace or an occupational illness, unless it could be absolutely tied back to exposure at the mine, due to an outbreak, or someone had no exposure anywhere else and then worked closely with a COVID positive person at the mine and the exposure was directly linked to that. So it was a pretty high bar. For the most part, it wasn't expected to be reported on 7001s. At least that was my discussions with MSHA managers. MSHA now expects that operators will report and record COVID work-related illnesses, but we don't have specific guidance on what is work-related. And so here's an instance where MSHA, clarified that they want these to be reported, but didn't tell us what they want us to do to determine work-relatedness, which is somewhat good and somewhat bad, right? Because then what it comes down to, and we talked about this on the call, and I specifically asked the MSHA personnel on the stakeholder call, so is a determination of work-relatedness come down to the decision and investigation of the operator, and if necessary, when they work with local or state guidance and authorities? And the answer was yes. So MSHA is still asking you to voluntarily report all cases, but you only have to submit a 7001 for work-related ones. So what MSHA put out there in the guidance is it's a confirmed case. The case is an occupational illness, and it involves one or more of the relevant recording criteria, i.e., someone received medical treatment beyond first aid, or they were away from work. Obviously, if someone is exposed to COVID, they're going to be away from work. Just for the purposes of being clear, they cite a definition in there. If occupational illness, according to MSHA, is an illness or disease of a miner which may have resulted from work at a mine or for which an award of compensation is made. So, what that means is we need to do a determination about whether or not an exposure is work-related. And again, here we look to OSHA, because OSHA has given us a framework for this. And if you've been on some of my webinars throughout the year, and we've talked about COVID, you've probably seen this before, but this is what we got from OSHA. Since MSHA is not giving us specifics, we should rely on what we know to be other guidance from an occupational safety and health and government body. So employers must undertake a case-by-case relatedness analysis. We know that, and determine whether it's more likely than not that an exposure is exposure in the workplace caused the illness. So we want to document this, right? We want to keep a file. We want to keep a breadcrumbs about why we made this decision, so that if MSHA comes out on a complaint that we're not reporting, or on an investigation, they want to see all of our 7001s, we can explain why we determined a certain case was work-related or not. So, is someone infected soon after contact with a confirmed case from work and there's no other explanation? That would be probably a likely work-related. Are there several cases among workers with close contact and no alternative explanation? Again, this is kind of the outbreak criteria. It's likely to be work-related. So job duties include frequent exposure to the general public in an area with ongoing community spread, probably not very relevant to the mining industry at all times. Some jobs perhaps, but not the vast majority of miners. and there's no alternate explanation. So what is an alternate explanation? Alternate explanation is that person went to a wedding the weekend before, or they went to a cookout with family and someone there had COVID, or they worked a second job in a supermarket or something along those lines. So you want to talk about with the individual, what do they think was where they got it? Are there any other cases at work or any other person showing symptoms? And what is more likely than not to be the cause of it? If someone worked with a partner at the mine, both of them now have COVID, one of them could very well be work related. Maybe not both of them though. So these are the questions that you need to ask. Where were you? What have you been doing? Who have you been with? Do you live with someone who was COVID related? Did you go out to dinner with someone who you later found out? Or did you just go out with a large group or meet with a large group in some capacity, whether it's church or a cookout or et cetera? So, we didn't get specific guidance from MSHA. We can look at this as guidance. The best thing we need to do though is we need to document that, because we want to be able to have something again in black and white that says we did an analysis. These are questions we asked. This is why we made our decision. Now, if MSHA wants to say our decision was wrong, they'll have to tell us why our decision was wrong, because we have the reasoning broken down. But if we don't have that, we don't have any real support if we're called on why we're not submitting these 7,001s. This is also another area where we can start getting enforcement. MSHA can issue citations for failing to submit injury and illness reports through 7,001s on a timely basis. Also remember, if you're doing that, you need to follow up with a return to work appendix. So beware of that. These 7,001s, as always, are due within 10 days of the exposure in this case, or someone coming down with it. So, those are going to be timeframes that still apply. The other item that we want to talk about is 105C briefly. And so, we talked about it. This is just going to be the whistleblower protection side. We have to make sure that minors understand that they can ask questions. We also need to know, as an operator, how to properly handle these and respond to them, including dealing with any complaint by MSHA. I mean, remember, if someone comes and brings a complaint that they don't believe that the safety and health is up to par at your mine, you need to look into it, and you cannot discriminate against them for that. That is then protected activity. If someone calls MSHA and says that they think there's concerns of the mine, you cannot retaliate against them for doing that, because that is protected activity. You're then going to absolutely get an investigation and probably a positive finding by MSHA that you violated their miners' rights. MSHA suggests in here, considering a hotline or other method for miners to voice concerns anonymously. That is one way to kind of limit drilling back down to the person even feeling like they could be discriminated against because it was an anonymous. But there are retaliation or prohibitions against retaliation, and that applies to this. And it's not just for minors. It applies to minors' representatives, and it applies to applicants for employment, actually. So, you need to be very careful about how you're reacting to complaints, and if you're taking them seriously or not. You need to take them seriously. You need to act on them, and you cannot punish someone for making those complaints, whether they're made to you as an operator, a management member of the operator, or if you're hearing that they're making them to an MSHA inspector or calling MSHA directly. So beware of that. That is certainly going to be something that MSHA is looking at. If we are training on this, we should be sure, just because it's such a prominent part of MSHA's guidance, to make sure that miners know that the same rights apply with their minor rights to COVID as a safety and health issue. But you just want to be very clear and very cautious not to discriminate against anyone. So we're getting close to the end, and I'll just say, if you've gone through some of these webinars over the last year with me, we've talked about exposure control plans a number of times. That's what our firm has been calling them, and we've been doing them since last March and recommending that companies put them in place since last March. They're really one of those first items that you can put together that help reduce employee concerns. Now MSHA is recommending them formally. OSHA's been recommending them for a while. But we have as a firm been recommending them for a while. And there's a lot of reasons. And we put together kind of our boiled down 6 reasons for that. So addressing employee concerns, addressing concerns of enforcement agencies, whether that's MSHA or OSHA, helping in defense against claims by either enforcement body or by state or local entities. It's an easy way to provide information to people outside of your workforce regarding what you're doing on site, whether that's customers or contractors or the union. It also makes it easier to update what you're doing because everything's stored in a single place. This is going to be a great document that we want to have in the event that there is, a tidal wave, so to speak, or a wave of personal injury claims or kind of class action suits in the future. If we have one of these programs in place, it can be a very good item that we can lean to, especially if we don't have one in place so far. Putting one in place quickly after it's been recommended and included in guidance by our regulatory body here, MSHA, is something that we should consider. And last but certainly not least on this was reduces instances of infection, which is the intent of this, right? It's not just a defensive document. It's supposed to be preventing exposures in the workplace and helping protect the workplace. So I took the liberty of adding a 7th one. While MSHA is not saying that they don't need to approve these, they don't need to review them all, I think that we would all be naive to think that they're not going to be asked for at some point by an inspector when they're on site, especially now that the guidance is placed. Okay, we know that it is some guidance is something that the inspectors pay attention to. So if you're getting a special investigator on a COVID matter, they're definitely going to look into it. They're definitely going to want to see this document. If you don't have it, they're not going to be able to cite you for that, but I guarantee it will lead to greater scrutiny of everything else that's going on. If just a regular inspectors out there on your 2s and 4s, I think it's very possible that they could start asking questions about it and also start asking questions of the workforce when they're out doing kind of walkarounds and, talking to the individual miners doing their duties. So, beware of that. And I know this is recommended. I know this is not a new regulation, but again, we've been recommending that employers have a COVID exposure control plan in place for almost 12 months now. MSHA's finally gotten on board. I think that each operation should have one of these, and especially now, since MSHA is stating the same, you need to consider it as a real possibility, putting one of these in place, getting it trained on if you haven't done so, because I think that we could see some questions about it. And a big thing about hopefully avoiding an ETS here with MSHA is going to be if they find overall operators are complying with this guidance. So if inspectors are going out and they're saying, oh yeah, we see a lot of compliance with the guidance, we see best practices in place, it's being followed, that may move the needle. It may not, but it may move the needle with MSHA saying, maybe we don't need to put an emergency or temporary standard in place. You'd hope that would be taken into consideration, especially if we're doing this, lobbying through our state associations or our national associations. Compliance with this is a reason not to need an ETS. That should be taken into consideration as well. So, I do recommend that you guys put one in place. If you have questions on it, let me know. We've been working on them for a while, so we can work through the questions, work through the specific elements, help tailor them to your operations. But you really should look at getting a COVID prevention plan or exposure control plan, whatever you're calling it, in place at your operations, and tailoring them a bit specifically to each one. You can, if you have multiple operations, you can certainly create an overarching document, but then tailor it in a bit at each location. We'll just round out. It does talk a good bit about what is an acceptable face mask and wearing those. Just remember, look back, CDC has guidance on what we want to see from a face mask. What are the criteria for having an effective face covering? Look at those. If you are having people wear the respirators, make sure you're complying with the requirements of respiratory protection plans. If you're requiring it, keep that in mind. What has to go into if you're putting someone in a respirator? If you are requiring, and we all should be having people wear face coverings at site, make sure you're providing those or giving access to them. If people want to bring their own and you're allowing them to do that, just make sure they meet the CDC criteria. Those are kind of important elements that, you just want to keep going because they are in there. So what are some takeaways from this? It's guidance. It could become an ETS. This could be very similar to what we see in an ETS. We'll know more about that once we see the OSHA ETS coming out, because likely if MSHA does put one out, it's going to be very similar to what OSHA does. We'll see. Vaccinations are ramping up. Perhaps at this point, MSHA is going to wait and see, how companies react to the guidance, what we see from implementation of the OSHA ETS, and then make a determination. So we still might not see one, but it's still possible as well. As I mentioned before, expect some scrutiny just based off what we've seen in the past on, guidance from MSHA. I always kind of think on guidance on MSHA and not really following it, going back to a program policy letter from a few years back where they said they were going to adhere to the OSHA 6-foot rule. And then a bunch of people started getting citations for not wearing fall protection when they were, less than 6 feet above the ground. And there was obviously the get out of jail free card for MSHA where it's fact specific. So, they can look at these. They might not be able to cite you for the plan or for having the plan in place, but there are other areas they can cite you which can be controlled or can be included in the plan and hopefully avoid that. If you have one, retrain on it, make sure it's up to date. If you don't have one, I recommend you do. If you get one and you do create one, train on it, document the training. Give management employees a refresher on how to respond to employee complaints and the importance of respecting those complaints and not taking adverse action against anyone making them or talking with MSHA about COVID just because of whistleblower protections. It's the minor's rights to do that. We should all respect those rights. We train on them. We should train on them annually with annual refresher. But also make sure that management has an idea how to handle those. And then, lastly, just keep an ear and an eye out for guidance from MSHA. If you're seeing different interpretations around the country, I recommend you try and keep some discussion going with either your local or your state agencies, or let me know if you're seeing interesting interpretations and, kind of boots on the ground reactions from inspectors so that we can, keep on top of how MSHA is really rolling this out and acting, because that will allow us to bring forth concerns to the agency. With that, we continue to update the MSHA Defense Report with all of this kind of relevant materials, both OSHA COVID specific items, which we think could apply to mine operations, or at least to non-mining operations that you guys are all concerned with. Also, anything that is going to be related to MSHA, obviously, and all the blogs are going to be posted up there too, as well as the recordings from these webinars. I'll tell you, we have some more webinars coming up this year. We're going to take a break in April, but we'll be back in the May, somewhat coincidentally, to speak about how to manage 110, which are agent investigations, and 105C, which are whistleblower investigations, obviously, based off what we're talking about today. So, come on, log in for that and join us. And, hopefully we don't have any lessons learned by then from individuals dealing with complaints about COVID, but we'll, talk about those instances of how to deal with that from the management side. With that, welcome any more questions. There's a couple sitting in the chat right now, so I will review those and you can talk to them. But if you want any more, put them in the chat. If you have specific questions that you'd rather just talk to me about, my phone number and my email are up on the screen right now. And I welcome you all to reach out to me directly. Okay, one question we have up is, if I have a CPP, COVID prevention program or COVID protection program, through our Cal OSHA program, would that be adequate for MSHA compliance? That's a good question. You do want to also watch out. California is one of the few, or really, agencies in the country that has concurrent enforcement in the mines with MSHA. And so the Cal OSHA ETS applies to mine sites. So if you do have a mine site in California, you should already have a CPP in place. Would that be able to roll out to the rest of the country? Yes, the framework should work for you. What I would recommend, though, is you review that Cal OSHA specific prevention program and make sure that any Cal OSHA provisions on record keeping or Cal OSHA provisions on reporting are removed, because they might not apply to the other locations where your facilities are. But overall, there's a lot of crossover. A lot of the programs that are going to be included in there, you probably have in place elsewhere, and that's just kind of your consolidated document on that. So yes, you could take that Cal OSHA CPP as your framework, but I would recommend that you review it, do kind of a gap assessment on what might not apply to the mines elsewhere in the country, and remove that, because you don't want to have provisions in any program that don't apply to the locations, and that those locations where they're in place at are not going to follow. But yes, that would be one way to kind of streamline this process. If you already have a CPP in place for, you know, Cal OSHA facilities or OSHA facilities, you can certainly take that framework and put it into effect at the mines. I would just review it to make sure you don't have any unnecessary elements included in there. The next question is, since independent contractors, operators are included, does MSHA have an outreach for informing and educating them? And should we be asking them for their plan when they come on our mine site? So that's a good question. Their plan for outreach and education is the same as it is for the mine operators. So, you know, they have published the guidance. If you are a contractor who works on mine sites, you should be aware of and review the guidance, because you have constructive knowledge as it was posted on MSHA's website. As a mine operator bringing contractors on my site, I would want to know that they have some sort of program in place and policies in place regarding COVID. You know, whether or not they have a full CPP, a COVID prevention program, you know, per this guidance, they might not, especially if they're not primarily a mine contractor, but they might have that guidance, you know, piecemeal in individual programs, or they might have just their own exposure control plan, as, you know, they can be called as well. So I would say, you know, if you are bringing contractors on site, you can certainly ask them, are you aware of the guidance and what are you doing to react to it? And can we see a copy of your plan? Absolutely. You can say that, and you probably should say that, because just like any other element of bringing a contractor on site, you want to make sure that their training is up to par before they come. And in this case, that training and those programs and policies are specific to COVID. So yes, you can, you probably should. You can ask them for a copy of it. Again, they aren't required to have one. You know, this is guidance. I recommend it, but you aren't required. But as the mine operator bringing them on site, you can certainly ask them for whatever you want. And if they don't have one, you can share yours and say you are expected to follow this when you're on our site, and show them the best practices and the programs that you have in place regarding COVID. So that's another way if they don't have their own. All right, everyone, I think that looks like all the questions that are in right now. Again, if you have additional questions, or for any of those who ask questions, if you want to have some more discussion or some additional clarity on what you asked, I welcome you to reach out to me directly. But thank you for joining today. We will continue to give you guys updates on what's going on, and hope everyone has a good rest of the weekend. Thank you.